Hi everyone, this is Kathleen Carter here, and we're live in MPF's Patient Navigation Center. We're here with MPF volunteer Chris Pettit and his wife, Corrine. Welcome, you guys are so happy to have you here.
Thank you, we're happy to be here, yes.
So everyone, June is Men's Health Month, so we're here today to talk with Chris about fatherhood and psoriasis. Chris is here to share his story about living with psoriasis, and also we're going to be asking Chris and Corrine some questions about family life, raising 3 boys, and other topics related to men's health. So Chris and Corrine, do you guys mind sharing a little bit for our Facebook audience about yourselves and your connection to MPF?
I've actually been a volunteer with the MPF now for a little over a year. I am the proud father of 3 boys, and I'm also the host of Psoriatic Stand-Up. If a lot of you haven't heard of it, it's fine. We're pretty new. It's only been over the past year. Check us out. We're on YouTube. We have a Facebook page, Twitter. That's Stand Up with a P. That's how we do it in the psoriasis community. Yeah.
Awesome. Thanks. And Corrine?
Yeah, so I've been working at MPF for almost 2 years. I get to work with all of our wonderful volunteers across the nation, as well as being a wife and a mom to 3 boys.
And my agent.
Yeah.
Part of my rise to fame.
Perfect. So here's how today's session will work. We're going to be asking some questions of Chris and Corrine. If you guys have any questions for them about their experience, their life with psoriatic disease, feel free to send those in during today's session, and we'll be checking in to see what you guys are saying throughout our conversation. If you have any questions for MPF about psoriatic disease treatments or finding a doctor or any of those types of topics, we're going to be putting a question link in the description for the session, so you can contact a patient navigator with those questions. Great. Okay, so we'll go ahead and dive in. Chris, I understand that you were first diagnosed with psoriasis as a teenager. When was the first time your psoriasis really had an impact on your life?
Excuse me, jeez. I would say probably early on in high school, when I started, trying the whole dating thing, and I just kind of got weird looks when talking to girls was never an easy thing anyway, but psoriasis, didn't make it easy either. So that was tough. And I think the first time it really had an impact on me was, I think it was my junior year. I actually had a teacher come up to me in the middle of class and point at one of my arms. And she said, "That looks awful," in front of everybody. And so that was pretty eye-opening. I think that was probably the first time I realized, wow, not everybody out there is friendly and accepting, and it was pretty embarrassing. So there's that's really all I have to say about that. It's pretty angering. Actually, it's not a word, but yeah.
So when you were first diagnosed, how were you treating your psoriasis, and was that treatment successful for you?
Let's see. When I was first diagnosed, I don't think my doctor really understood what it was at first. So it was just a matter of keeping me comfortable. So it was using a lot of topicals, keeping the areas from drying out and cracking. There weren't really, I don't even think biologics were a thing back then. So it was just a lot of, use this ointment, use that lotion, just keep yourself comfortable. And so not a whole lot that worked. So when and how did you and Corrine meet, and what were your first impressions of each other? Well, we met at, this is going to sound really cheesy and kind of cliche, but we met in a church youth group, actually, and it was in a small town in Washington, Boisfort, Curtis.
Yeah, shout out Boisfort.
I don't even know what town. I guess it was Boisfort Church, so I guess it was in Boisfort. And I thought she was a snob. I didn't like her too much at first, but she was cute. So.
And he had just moved from Portland, and I was related to like 80% of the people in town, so I thought, wow, well, he's okay looking. And
I came from a big city, and I didn't know where most of my family members are. We're all spread out, so yeah.
But he had terrible fashion sense. Truly awful.
Yeah. Harry Potter glasses aren't for everybody.
Yeah. Corrine, tell us about when you first started working for MPF. What did that change for you? What was that experience like?
Yeah, so it was a huge change for us. When I started working for MPF, we had been married for almost 10 years, and he had had psoriasis the entire length of our marriage, and he's covered about 85% of his body. And we'd been to many dermatologists together, but they offered topicals that would work for a little bit and stopped working. So we just kind of worked our life around the psoriasis. We didn't buy white sheets, and I had to change the sheets 2 to 3 times a week and sweep 3 to 5 times a day, and we just kind of lived with it. We had a lot of family members that weren't very accepting and didn't even like us at their house because of the disease. So we were just living with it, and one of the navigators came to talk to me my first week there and asked me about my husband having the disease, and I told him, yeah, he's 85% cover, but won't really treat it. And she let me know that there's comorbidities associated with psoriasis, and that there's psoriatic arthritis, and these were things that we had never heard about. We didn't even know it was an immune-mediated disease. And so I brought that information home to Christopher, and we talked about it, and the next week he scheduled an appointment with his dermatologist and got on some appropriate treatment, and now he's almost clear, which has really changed our life a lot.
Yeah.
And I must make psoriasis look good, because look who I'm married to. Yeah, no worries out there, guys. No worries.
So Chris, tell us what that experience has been like for you, changing treatments and getting to be almost clear.
It's been great, actually. I've grown quite fond of it. Being able to wear shorts and short sleeves when it's 100 degrees out. Being able to take my kids places and not get stared at. Yeah, it's been really good. But with that, though, comes the fear of it coming back, because all of us out there know, all of us with psoriasis know that nothing is really, until they find a cure, nothing is 100%. So there's a good chance it could stop working, and then it's just on to the next thing. So it's something I try to keep my chin up about and try not to get discouraged. So it's just a matter of keeping that upbeat attitude. And again, look what I'm married to. Seriously, I make it look good.
Great. With Father's Day right around the corner, let's shift the focus to parenthood and psoriatic disease. So between raising 3 boys and working, I bet you guys, your life is very, very busy. So how do you juggle everything that you have going on with raising kids and working, and if any advice that you'd give to other parents out there?
Well, I think the first thing I would say is parenting is hard whether you have psoriasis or not. And as far as parenting with psoriasis, I guess, it's one thing we try to focus on with our kids. Our oldest is 5, and so he obviously doesn't understand the medical end of psoriasis and what it actually is. So what we really try to stress with him is it's really important to not treat people differently because of the way their skin looks. To love everybody, as people, and not the way they look. So we really try to focus on that, and we try really hard not to talk about psoriasis in a negative way. We tell them, it's a disease that Daddy has and a lot of other people have, but it's not it's not a death sentence. It's not something. It's not something to be ashamed of. It's just something you have. So we try really hard to make sure that he understands that. So.
But as a married couple, what questions do you get from others about psoriasis?
Well, I think, like she mentioned earlier, I think it's does it bother you that he has this?
Mm-hmm.
Or, does it? Girls talk. Does he have it down there? That kind of thing. Yeah, I did. When I was at my worst day. 85%. When you're 85% covered, there's a good chance you're going to have it down there. It's unfortunately. That's one of those uncomfortable things to talk about, but it's real, Mm-hmm. And so, yeah, I think those are 2 of the big ones.
Along with, are you afraid that your kids are going to get it?
There's that too.
Which, of course, that's a terrifying thought for us. And I'm kind of glad that we didn't think of that a whole lot when, that we didn't know all about psoriasis before we started having kids. So those are definitely big questions.
Mm-hmm. Yeah, because I've actually heard about people who don't want to have kids who have psoriasis, who are afraid because they might pass it on, but which is really sad to me.
Yeah.
So. awareness is important.
Absolutely. Do any of your kids
Oh.
have psoriasis?
No, not that we know of. Not so far. They haven't shown any signs yet, so hopefully they don't.
It's definitely terrifying. I mean,
Yeah.
our pediatrician gets calls from us all the time if there's a red mark or a dry spot. We're like, hey, could you check this out? We're just kind of hyper aware of any little thing on their body and their skin.
Yeah. Oh, and Tom Easygoing says, "Cool, nice job, guys." Thanks, Tom.
Thanks, Easy.
Okay. So, Chris, what motivates you now to go see your doctor and get regular checkups?
Well, it's just knowing what it's like to be clear now, and knowing that going to your doctor. If you trust your doctor, it pays off. So, knowing that there's a chance that I can continue to be clear. So it is very important you go and see your doctor. So that's what keeps me going, and just knowing that. It also, because I know a big fear of biologics is the side effects. And going and seeing my doctor kind of gives me comfort, knowing that, okay, well, you're looking good health-wise, so keep doing what you're doing. So that way I'm not like, okay, well, is what I'm taking hurting me and, at the same time it's helping me. So it does help. And knowing that it's actually working still, that also motivates me, because I really I can't tell on my own. I don't have a trained eye. So yeah, definitely. Staying clear is motivation enough.
Great. So, Karine, as a mother and as a wife, how do you encourage your family to take an active role with their health care? And how do you support Chris with his psoriasis?
Yeah, so it's definitely a huge thing for me. My degree's in healthcare, so I always, make sure that everyone has their doctor's appointments, dentist appointments, eating healthy, making sure everyone's, getting out and active. And then with Christopher, we always joke that I'm, his secretary, so
My agent.
secretary, agent, everything. So I, make sure that his prescription's coming on the right time. His medication has to be refrigerated, so making sure as soon as it's delivered that it's put in the refrigerator. And then I actually get the pleasure of injecting him, which was really scary at first, but now, especially if it's a bad day, it's nice to give him the pokes.
You didn't do the dishes, it's sticking time. It's not till next week. Gotta do it now.
Oh, I love that. So, Karine, what advice would you give to others who are supporting loved ones with a chronic disease like psoriasis or psoriatic arthritis?
Yeah, that's a great question. So I would say support your loved one however you can. Go to the doctor's appointments. Have your own list of questions. It's it's okay for you to take part in that as well. And then the biggest thing I would say is give yourself grace. Sometimes you're not always going to say the right things, or sometimes you're going to get frustrated. There's many times where, I get mad at Christopher thinking he's just being lazy, forgetting that fatigue's a huge part of this disease. So,
Flaring.
yeah. So, just give yourself grace and do the best you can, because you're doing a really great thing. So just remember that.
Great advice.